Bismillahirrahmanirrahim. Today we are going to start a new chapter important to everyday practice and study, that is osteology. Small parts of this subject will be reviewed today. Easier to grab really. The first thing we are going to discuss with the vitamin D deficiency disease. Ricket is said in the earlyhood of life, by 18 months of the age of the children, it is expressed. But this deficiency also occurs in the late-aged patients who has got the limited sun exposure, and other malnutrition conditions. So vitamin D deficiency disease is a part of our everyday practice. We should be careful enough so that it is not missed, as the outcome is the debility is much more in the society. The vitamin D deficiency disease in the childhood is known as the ricket. How it is expressed really? The delayed appearance of epiphysis or other milestones of development like delayed dentition. That's how there is delayed appearance of epiphysis noted. And there is widening of the growth plate. What is growth plate really? The growth plate is the growing end of the bone, so that there is a bony density at the epiphysis and the nearby bones of the forming joint. There is a gap is called the growth plate. The growth plate is the epiphysis and the metaphysis in between what is the growth plate, and it is and widening in cases of vitamin D deficiency disease. There is general reduction of the bone density as a whole. That is called osteopenia. How can you go for osteopenia? That is another topic you need to discuss about. Later on we'll come to know. Fraying is the indistinct margins of the metaphysis and increased trabeculation of bones. It means there are much more osteoid tissue present. Those has not been ossified. There is increased accumulation of the osteoid material, but the ossification is delayed. So there is increased trabeculation of the bone and indistinct margins of the metaphysis. Splaying of the bone is also present, that is widening of the metaphyseal end. What is that? Let us come to see here. This chest X-ray has got multiple features of vitamin D deficiency. That is, the density of the bone is reduced. As a beginner, as a very primitive studying of the radiology, you should just notice that there the clavicles here, the humerus and the bone case is not looking very bright. So that there is very reduced density running along the lateral aspect, and the density of the rib is also reduced. So bone density reduction is a relative appreciation by a person to person. It varies, so that you need an expert eye to declare osteopenia before you really come to know that yes, there is osteopenia. What is here? You see, this is a long bone humerus, the medial ends. There is increased growth plate, that is, the epiphysis will be here. That is also till it is cartilaginous, going to unite with this scapular lateral angle and acetabulum. And so this is the epiphysis. This is the epiphyseal end is not seen here. This is this is the line here, and there is widening of the metaphysis, and the growth plate is increased. Thickness of the growth plate is much more than usual. So the long bones are found in this way, that there is reduced density of the bone, there is increased osteoid tissue along the metaphyseal end, there is widening of the metaphysis, and there is increased thickness of the growth plate. And then, and this is the indistinct margins of the metaphysis and increased trabulation. Both are due to the increased amount of osteoid tissue not has been ossified. There is no calcification deposited. That's why there is widening of the growth plate and the indistinct margins of the metaphysis and increased trabeculation of the bone. And this increased trabeculation is basically also due to osteopenia and also the osteoid material amount to be increased. And widening of the metaphyseal end we have seen. And where these are located, the location of the vitamin D deficiency ricket involves the joints subjected to stress, like where there is movement much more, like wrist joint, knee joint, ankle joints, etc. There is concavity of the metaphysis also, and there is bowing of the legs. The long bones are bowed, and the outer concomitant deformity of the hip, there may be 𝗧𝑐𝗃𝑠𝑎 or 𝗧𝑐𝗃𝑠𝑎 vulgar. Usually we used to memorize a photograph of a child with bowing of the leg bones. This is the common picture we can recall whenever there is any discussion of ricket happens. So bowing of the leg is the preliminary presentation. Socially, the child is brought to the doctor due to the bowing of the legs. And where the bowing happens, the bowing of the leg happens because there is softening of the bone, and whenever the child starts walking, then the bowing of the legs happen. And the rachitic rosary is a special feature of the ribs. There are widening and demineralization of the anterior ends of the rib. It means the anterior ends of the ribs are widened, and there is demineralization and produces nodularity of the costochondral junction. Here, this special feature is also present. You see the spade-like widening of the anterior ends of the ribs. There is the rest Non-visualized part is the costochondral. The chondral part, there is costochondral junction. And the nodularity is really perceived from the physical examination of the children. Now, with the sequence of the vitamin D deficiency, another childhood disease of the bone is vitamin C deficiency disease, that is scurvy. And why we need to go through such study of bones together, that is, and both the disease are due to childhood osteopenic states, and these diseases are preventable and also very typically presents with the radiological features, and the early detection gives the early relief of the symptoms, and outcome is nice. Vitamin C deficiency disease occurs in more early ages, like by 9 months we used to say that the stored vitamin C in a newborn gets to be used if there is no maternal supply through the milk. So the disease is expressed by about 9 months of the age of the infant. What is there? Again, generalized osteopenia. There is cortical thinning that is called pencil point cortex. That means there is so much osteopenia that the cortex can be drawn by the tip of a pencil, that is called pencil point cortex. And there is periosteal reaction and subperiosteal hematoma. And what is the clinical presentation from the ward? We can think of what is the scenario of the vitamin C deficiency disease, that is a crying baby of below 1 year age, and whenever you touch the infant, it will cry. It means there is crying of the baby, and whenever there is physical movement of the baby, there is increased crying. It means he or she has got much pain in the limbs. Why there is pain really? We will come to know that there is subperiosteal hematoma. What happens when there is vitamin C deficiency? There is hydroxyproline formation is hampered, which is very important component of protein that is causing the structure of the bone formation. And so there is elevation of there is a weakening of the structural bone, there is periosteal elevation, and there is hematoma under the periosteum, leads to subperiosteal hematoma. There is also sometimes hemarthrosis. There is Weinberger sign present in the vitamin C deficiency disease, that is the circular opaque radiological shadow surrounding the ring of epiphysis. It is produced due to repeated hematoma of the epiphysis under the cortex. And there are some popular names related to these two disorders. There are Frankel's line, dense zone of provisional calcification. the tremor filled zone, the lucency and the dense metaphysis. Here, this is the photograph you come to know. You see, this is a bone, and this is the cortex, very thin, and this is the Weinberger sign we have said. There is eggshell-like ring of calcification to show the Weinberger sign. There is scorbutic zone or tremor-filled zone, that is the zone of provisional calcification, Frankel's line. There is a sclerosis of the zone of provisional calcification. There is sclerosis and a spar forming at the corner of the metaphysis. This is called Pilkins sign. And what is here? There is elevation of the periosteum. And any cause of periosteal elevation produces bone formation in and around the periosteum. That is called periosteal reaction. And there is the lucent area is occupied by the hematoma under the periosteum. So this is subperiosteal hematoma, present both in this femoral warrant and the adjacent tibial upper ends on both sides of the bone. So this is subperiosteal hematoma. And this is tremor-filled zone, and this is white line of Frankel. These are the popular terms related to the vitamin C deficiency disease. There is a dense zone of tremor of the Franklin, the white zone of provisional calcification, and there is a subjacent to this white zone, there is tremor-filled zone of lucency. Finally, we are trying to describe an X-ray with chronic osteomyelitis. Before going to this X-ray, we are here to try to understand how to describe an X-ray with a bone deformity. Whenever there is an inflammation, there is edema. Any bone disorder, whether inflammatory or any tumor, has some signs to be described. There is deformity of the bone we have seen. This is a bone of, this is which one? This is tibia, this is fibula. Something is abnormal here along the shaft, almost sparing the upper and the visible total shaft is seen some abnormal density present. Now what is to see? That whether this lesion is benign or if there is any tumor conditions present or not, whether it is an inflammatory condition or this is a malignant condition or tumorous condition. The first thing is whether there is expansion or destruction present or not. No, there is no expansion of the bone seen here. And the second is the visualization of the fat planes related to the lesion. Whenever there is preservation of the fat planes in the affected bone area, it means there is no tissue edema in relation. It means if in this case, you see that there is no fat planes to be preserved here. So this might be a case of inflammatory lesion because there is inflammation of the bone and related tissue. Anything wrong? I don't know. So this lesion has got an inflammation along the related areas, related regions of the bone. That is, there is loss of the fat planes to be visible in the X-ray plate. So there would be edema that has been spreaded from the affected bone. So whenever you try to describe the bones affected, you first think of the two things. First one, the deformity of expansion or destruction, and the thing is the visibility of the fat planes of the muscles or organs around. These things really give you a very good clue to go through the image properly. So what happens here? Let's try to visualize. There is the cortex is thick here. There is periosteal reaction and there is increased bone density running around the lateral aspect of this bone. There is a gapping area seen in the cortex here, and it has got a long transitional zone. What is transitional zone? It means the affected area and the normal area. Whatever the affected area, its relation to the normal area, a long gap is present here. There is a long gap present here. That would be inflammatory or it would be mitotic. And whenever this transition zone is short, that is straight benign lesion. There is a gap present here that is called cloaca. Cloaca is something else, a gap that transmits the interior pressurized substance to the exterior. There is inflammatory materials will be pushed outside. And you see there is sclerosis and 𝗧cie mixed tissues here present. Also, there is a periosteal reaction running here. These subparts of these dead bones gets lost through this cloaca. So this is a chronic osteomyelitis that has got a long transitional zone, a cloaca, a sequestrum present here, and there is loss of the tissue fat planes. So this is a general idea about a chronic inflammation today. And you see this is MRI. Is there any difference between the photograph on both sides? You try to understand, please. This is the soft tissue plane. MRI is super duper modality to delineate the soft tissue intensity, and soft tissue delineation is really best in MRI. other than any modalities. So what is there? This bone, this is the epiphysis, and this is the bone. You see that there is increased density noted in the total length from this mid part downward. This is the edema and the inflammatory exudates that is not present here. It means it is isodense, means there is marrow tissues in the normal part, and there is marrow edema noted here, and the inflammatory fluid really present in the mid and lower parts of the tibia. And we were talking about the tissue plane and the inflammation of the tissue plane producing loss of fat planes is noted here. You see, there is edema of the leg here and here, that is displayed as increased intensity of the tissue compared to the normal parts noted in the upper part of the leg. So there is fluid in the tibial mid and lower shafts. There is deformity also seen here. Probably this is the area of cloaca, and the inflammatory materials are loaded in the mid and lower parts of the tibia. So today we are going to close the session. If you need to know it elaborately, you can ask me. I think this preliminary is much enough for you to understand bone lesion. Later on, we are going to discuss other parts of osteology. So if you have any question, you can ask me in the messenger. I am there. If you don't have any question, we are going to close this session, and later on we'll discuss the other parts, other aspects of osteomyelitis. So thank you everybody for patience hearing. Assalamu alaikum.